So, very good afternoon to one and all. Myself, Dr. Naresh Rangla, working as Associate Professor at ISF College of Pharmacy. Welcome you all to this ISFCP sponsored dialogue series. So, before starting the session, I would like to invite uh, our worthy director, sir, Professor Dr. G.D. Gupta, sir, for their inauguration marks.
Hello.
Yes, sir. Yes, sir. So, welcome
So,
you for the inauguration remarks.
yeah. Thank you very much, Rangraji. So, first of all, I welcome today's one of the dynamic experts and Dr. Anamika Sharma ji. So, welcome you, Dr. Anamika at ISF College of Pharmacy, ISF Dialogue Series.
Thank you, sir.
Welcome. So I also welcome all the coordinator as well as all audience, those who are the connect on through the YouTube channel. So Anamka ji, as you know that ISF College of Pharmacy started this ISF dialogue series. Purpose behind of this to connect the peoples, those who are the working in a specific field, so that we can provide the proper knowledge, information, some of the software knowledge to our audience, pharmacy peoples, those are the working in such institute where all types of the facilities are not available, and also to aware about the technology like that. So thank you very much for accepting our invitation, and you have spare your valuable time to deliver a talk to the profession also. So without taking time, I welcome you and request you please give your talk on the topic of the mystery of cytokines in the colitis and their regulation by natural drugs. Thank you very much, Dr. Anamika.
Thank you, sir.
Okay, thank you, sir. Before starting the session, I would like to introduce you to the today's speaker. It is Dr. Anamika Sharma. She is working as scientist too at Biological Science Division, National Institute of Pharmaceutical Education and Research, NIPER, Hyderabad. And she is a alumnus of Government College of Pharmacy, Rodu. She achieved her M Pharmacy in Pharmacology branch from Kurukshetra University, Kurukshetra, and received PhD from CSIR Institute of Himalayan Bioresource Technology (IHBT), Palampur, HP. His research areas are immunology and molecular biology, and she has received so many awards from DST SRB International Travel Scheme, PIMSA Bursary Award, BSI Congress Travel Bursary Award, and ICMR SRF Award. So I welcome you, Dr. Anamika, on this on today's talk, that is the mystery of cytokines in colitis and their regulation by natural drugs. Over to you.
Before going to discuss about the mystery of cytokine in colitis and their regulation by natural drug, first of all, I would like to thank the chairman of college, Praveen Garg ji, director cum principal, Dr. G.D. Gupta ji, vice principal, R.K. Narang ji, and coordinator, Dr. Naresh Rangra, for inviting me in this IQAC-ISFCP dialogue series. So, now I'm going to discuss about the mystery of cytokine in colitis and their regulation by natural drugs. We all know ulcerative colitis is a chronic inflammatory disease which mainly affects the colon and rectum region of the large intestine. The incidence of the incidence of ulcerative colitis is increasing worldwide and particularly in developed country and also in developing countries. The etiology of ulcerative colitis is still in its infancy and still enigmatic. The complex pathways are involved in the ulcerative colitis. It is mainly regulated by a vicious circle of signaling cascades, inflammatory cytokines, which mainly affect the integrity of ulcerative colon region and mainly the colon. The treatments available are 5-aminosalicylic acid, corticosteroids, immunomodulatory drugs, and biologics. The epidemiology, it is equally distributed among the different genders. Sorry, there is some disturbance. It is equally distributed among different genders, and it is mainly regulated by the disruption in the inflammatory cytokine value. Basically, there is an increase in pro-inflammatory cytokines and decrease in the anti-inflammatory cytokines, which particularly causes the disruption in the epithelial integrity, which further causes the leaky gut and impairment in the immune cells, and ultimately causes disruption in the gut microbiota, which causes the systemic circulation. Here is the mechanism basically take place during inflammatory responses. The pathogen associated patterns and damaged cells are first sensed by toll-like receptors and pattern recognition receptors. They act as a sensor for these inducers, and on activation of these sensors, there is a induction of inflammatory cascades, particularly NF-kappa B, MAP kinases, PI3K, AKT, GSK3 beta, and other inflammatory cascades, which causes the regulation of cytokines, chemokines, and other inflammatory mediators. However, when this mechanism goes beyond certain limit, there is an excessive and disruption in this mechanism. The disruption in this mechanism causes the dysregulation in the cytokines. Particularly, it causes excessive production of reactive oxygen species, pro-inflammatory cytokines like TNF alpha, IL-1 beta, IL-6, and IFN gamma, which causes further activation of the leukocyte at the site of injury and ultimately leads to chronic and bad inflammation. Here, these slides represent the pathology of ulcerative colitis. First, when the colon region encountered by any antigen, any pathogen, there is a defective regulation of tight junctions, which causes activation of immune cells, resident immune cells, particularly macrophages, and these macrophages causes release of pro-inflammatory cytokines TNF alpha, IL-22, 12, 23, IL-6, and IL-1 beta, which further causes the activation of other immune cells. And activation of other immune cells like dendritic cells further causes the regulation of Tregs, and which causes the activation of IL-4 and IL-13. But again, the disruption in this scenario causes the disruption in the epithelial barrier functions and epithelial integrity, which increases the epithelial permeability and causes leaky gut, which causes disruption in the gut microbiome. Means there is a enhancement of harmful bacteria and reduction in the beneficial bacteria, and these events further causes the systemic circulation and causes perturbation in the cycle of inflammation and leads to colon damage and colon inflammation. Here the cytokines, which play an important role in the regulation of ulcerative colitis. Basically, these cytokines are secreted by different sources, different and they have different targets, and they have different targets. Specifically, like there are Th1 cells, Th2, Th19, 17, 22, Tregs, Tr cells, and V cells, which play an important role in the pathogenesis of ulcerative colitis. And simultaneously, They further causes the activation of particular transcription factor, which causes the release of particular cyto-inflammatory mediators and cytokines. Like if there is an induction of TNF alpha with on as and IL-12 act as an inducer, it causes the induction in ulcerative colitis. Similarly, if there is a induction of IL-6 with IL-12, it causes induction in the ulcerative colitis. And the same time, if there is an induction of TNF alpha with on IL-6, it causes barrier. It helps to resolve the colon inflammation and helps to maintain the epithelial barrier. Similarly, with IL-6, it also play a dual role. It play an important role in the progression of ulcerative colitis, and same time it play an important role in the resolution of inflammation, and ultimately play an important role in colon mucus healing. TGF beta also act in a similar fashion. It play an important role in the resolution of in the resolution of colon inflammation and protect the integrity of colon. But while the same time, if it secreted at beyond certain limit, it causes excessive fibrosis and leads to colitis associated colon cancer. Here, these slides represent the role of individual cytokines in the pathogenesis of ulcerative colitis. Like TNF alpha, as I previously explained, it play an important role in the regulation of ulcerative colitis. Here, this slide represents the role of TNF alpha as a causative factor and as a factor which play an important role in the epithelial in impairing the epithelial barrier function and impairing the integrity of epithelium. While the same time, IL-6 play an important role in the resolution of colon inflammation. It inhibits the apoptosis and ultimately helps in the colon proliferation, which ultimately leads to colon healing. Similarly, here this slide represents the role of TGF beta as a causative factor in the ulcerative colitis, as it induces the excessive activation of T and dendritic cells. Similarly, the IL-10, which IL-10 act as a pro-inflammatory cytokine. It helps in maintaining the pro-inflammatory cytokines ratio and helps to maintain their milieu during ulcerative colitis or during colon inflammation. Here, the slide represents the role of IL-12 as a in initiating the colon inflammation, while IL-23 as an amplifier of IL-17, which ultimately causes the colon inflammation. This slide represents the role of IL-13, which is a Th2 cytokines, and in some diseases, it play as a role as anti-inflammatory cytokine. But during ulcerative colitis, it affects basically IL-13 causes the release of other pro-inflammatory cytokines and ultimately affects the epithelial tight junction and causes apoptosis and colonic cell disruption. On the other hand, IL-13 play an important role in the epithelial restoration and mucosal healing. On the basis of this mysterious role of this cytokine in ulcerative colitis, researchers and clinicians developed researchers and clinicians studies the role of these cytokines for ulcerative colitis. They checked they induces IL deficient mice and check whether IL-10 play an important role in the induction or in the resolution of inflammation. They observed that deficient IL-10 are prone for chronic inflammation and also depicted the role of IL-10 in the resolution of inflammation. Similarly, they studied Treg cells depletion, TGF beta depletion, TNF alpha depletion, IL-6, and they observed the dual role. But the dual role, it depends upon whether the disease at early phase, the disease in early chronic phase, or it is in late chronic phase, and also the duration of the duration of and from which the sources from where these cytokines are secreted and on which these cytokines are acting. Here this slide represent the different drugs which are available till date for ulcerative colitis, and these are aminosalicylic acid, immunomodulator, and other biologics. But they are usually either inhibiting the particular cytokines, either blocking the particular pathway, or acting on a single facets. As I mentioned, ulcerative colitis is a complex disorder and it is regulated by multifacets factors. It is mainly the vicious circle of inflammatory cascades followed by inflammatory cytokines and mediators is involved in the induction of colonic inflammation and colon damage. So now it is imperative to search out those remedies which can simultaneously act on this vicious circle rather than acting on a single facets. And in this context, researchers are focusing on the natural remedies, and they are mm, studied natural entities for ulcerative colitis using different animal models as well as the cytokine deficient models. And these are the different animal models which are routinely used to study the different natural remedies for ulcerative colitis. And these are chemically induced models like oxazolone DSS, surgical model, pathogen induced model, and genetically manipulated like TL17, IL-10 deficient, TNF alpha deficient, TGF beta deficient models. And here, and on the basis of this cytokine mystery and the pathogenesis of ulcerative colitis, during in our lab we studied the one underutilized fruit Barbaris lycium fruit extract and its active constituent routine on DSS induced colitis model. We induced DSS for 14 days and established DSS induced colitis model. We checked the preventive effect of Barbaris lycium fruit extract and observe the effect of Barbaris lycium fruit extract on these cytokines and other pathological factors and other inflammatory facets which are ultimately regulated by these cytokines. Here, the shortening of colons indicate the development of colitis, as shortening of colon is the major parameter of colon inflammation. Here, from the histopathological slides clearly indicate the development of ulcerative colitis, as there is a infiltration of inflammatory cells, loss of goblet cells, crypt loss, and crypt damage. And these factors are reversed by the treatment of Barbaris lycium fruit extract. So next we observe the MPO, which is basically myeloperoxidase and basically secreted by neutrophils. We observe that the MPO level was increased on induction with DSS, indicate the activation of neutrophils, and indirectly indicate the cytokines, induction of cytokines, which indirectly or directly play important role in the activation of neutrophils. And we observe the reversal of this MPO level on treatment with Barbaris lycium fruit extract. Similarly, the role of IgE, which is mainly secreted by V cell, play an important role in the pathogenesis of ulcerative colitis, while IgA and IgG is protective for ulcerative colitis. And we also observe in this model the induction in IgE and reduction in the IgA level, which is reversed by the treatment of Barbaris lycium fruit extract. Then further, we check the different cytokines like Th1, Th2, and TSN17 origin. As I mentioned in previous slide that IL-4 play an important role in the induction of ulcerative colitis. But here we observe the mysterious role of IL-4 and we observe the down-regulated pattern in the IL-4, and which is IL-4, which was reversed by treatment with Barbaris lycium fruit extract. Similarly, we observed the upregulated pattern for TNF alpha, IL-1 beta, IFN gamma, IL-6, and other pro-inflammatory cytokines, and the reduction in the cytokine of IL-10, which was averted by the treatment of Barbaris lycium fruit extract. The disruption in these cytokine and these cytokine value further causes the disruption in the epithelial integrity, as I mentioned previously. We also observe the disruption in the epithelial integrity as evident by reduction in the occludin level, zona occludin level, MUC2 and MUC3. But here we observed a very slight increase in the integrity pattern with Barbaris lycium fruit extract, which depict here that the Barbaris lycium fruit extract is able to inhibit the colon damage significantly, while at the same time colon inflammation at significant level, while at the same time it is able to maintain the integrity at moderate level. Then we observe the CD3, CD4, and CD8 and Tregs pattern. We observe there is a proliferation in the T cells, which indicate the proliferation of T cell means there is a inflammation inside the particular region. Decrease in Tregs population means reduction in the anti-inflammatory scenario. While the treatment with Barbaris lycium fruit extract reverted this scenario and slightly increases the Treg population. Overall, from this study, we can conclude that the Barbaris lycium fruit extract can effectively and significantly suppress the level of innate immune cells regulated disruption in the cytokine and other facets, while it can maintain but slightly, not significantly, up to that level, the adaptive immune regulated disruption in the immune response as well as in the colonic damage. Similarly, in another study, we study the effect of rutin, but we induce the chronic model. We induced the DSS induced colitis and we used 4 cycles of DSS. Here again, the shortening of colon represent the induction of ulcerative colitis. Here, histopathological images and Elshon pass clearly indicate the loss in the cryptamus, loss in the colonic, shortening of colon, loss in the goblet cells, which was effectively prevented by the treatment with rutin. Similarly, we observe the cytokines. We observe the increase in TNF alpha, IL-1 beta, IL-10, IFN. But at the same time, here in chronic model, we observe the decrease in IFN gamma level. And in the previous slide, where I discussed about the acute chronic model, at that point, we observe increase in the level of IFN gamma during disease condition. So from these two studies, it is we can clearly depict that the cytokines really play a mysterious role in the induction of ulcerative colitis, but it depend upon the duration of the disease. Here, here this graph represented the ratio of pro-inflammatory and anti-inflammatory cytokines, and we observe these graphs clearly depict that the IL-10 able to maintain the maintain the pro-inflammatory value as decrease in IL-1 beta, TNF alpha, and IL-6 was observed with routine treatment. Similarly, we observe the adaptive response and we again observe the T cell proliferation as well as the CD8 cell proliferation and Tregs. And here we again observe the T cell proliferation, but in acute model, we observe the decrease in CD cell, cytotoxic cells. But here in chronic model, we observe the increase in CD8 cells, which was decreased by routine treatment, and the decrease in Treg cells was again improved by the treatment with routine. From these two studies, clearly indicate that the cytokines as well as their sources like Treg cells, other T cells play a mysterious role in the induction of as well as in the induction of ulcerative colitis as well as in the colon damage and colonic inflammation. But it depends on the duration as well as the source of the cytokine from where they are secreting and on which cells they are acting to further secrete the further cytokines. Thank you.
Thank you, Dr. Namika. So it was a very wonderful lecture. So on behalf of IQAC ISFCP cell, I extend a really hearty vote of thanks to our today's expert speaker, that is Dr. Anamika Sharma, who spared time from the busiest schedule to grace this event. Today we had an opportunity to hear your thoughts on the topic, that is mystery of cytokines in colitis and their regulation by natural drugs. And this will surely be going to encourage us in our future research events. So thank you again for this wonderful lecture.
Thank you, Naresh. Thank you all. Can I leave?